Hi, everyone. I am Judy Klein, president of Unity Consortium. On behalf of Unity, welcome to the imperative to vaccinate adolescents and young adults now. I invite you to write your questions in the Q&A area, and we will try to integrate those questions into the discussion. Adolescents have suffered uniquely during the pandemic. 2/3 of teens in a recent Unity survey report continued to have some or a lot of stress. Consequences can be serious, including reported higher levels of depression for adolescents who are under lockdown conditions. Another consequence is that preventative care has decreased. Well visits are down almost 1/3 for adolescents ages 11 to 17, and well visits are critical for checking adolescent both physical as well as emotional health, and of course, assessing immunization status at the same time. Meanwhile, as many of you know, vaccine hesitancy is up. Almost 2/3 of parents and teens agree that they have concerns about the safety of vaccines, and that safety concern often is driven by what they read on social media, especially for teens. This last year, we've seen a dramatic decrease in adolescent vaccination, leaving many susceptible to serious illness. I look forward to hearing from our panelists on what we can do now to dial up the urgency on routine adolescent vaccinations and help parents and teens embrace COVID-19 vaccines as they are becoming broadly available to adolescents. Now it's my great pleasure to introduce Dr. Chelsea Clinton, Vice Chair of the Clinton Foundation, who will lead this panel that brings together a wonderfully diverse perspective and expertises, including Dr. Tamara Coyne-Beasley, Vice Chair of Pediatrics at the University of Alabama, that's my alma mater, Birmingham, and past president of the Society on Adolescent Health and Medicine. Kelly Danielpour, founder of Vaccine and a Unity Teen Advisor. Richard Gordon, award-winning principal of Paul Robeson High School in Philadelphia, and Dr. L.J. Tan, Chief Strategy Officer at the Immunization Action Coalition and a Unity Special Advisor. And now, Dr. Chelsea Clinton.
Oh, thank you so much, Judy. I also just have to acknowledge, kind of as I think is rather routine in these kind of ongoing COVID days of virtual gatherings and working from home, that my children are having lunch right now, which I had shared with Judy and the panelists before kind of we went live because they were being quite noisy. And although now I think they're actually eating lunch, so being a little bit quieter, you may hear chatter in the background. And that's just the reality of me being able to thankfully do this from home today. And I am so excited about this conversation. And I really just want to, dive right in and, start with you, Dr. Tan, which is, Judy laid out the really kind of devastating consequence that the pandemic has had on routine well visits for children and adolescents alike. And for people who may not know kind of what happens at those visits, can you just talk about why they're so important and kind of why it's so important that we help kids, teenagers, like catch up on their immunizations?
Thank you very much, Dr. Clinton, and please just call me LJ. It's a pleasure to share this platform with you and all these wonderful panelists. So thank you for this opportunity and thank you for being here as a moderator. Yeah, that's a great point that you raised, and I think it suggests a couple of things have happened, right? I mean, I think before COVID-19 hit all of us, I mean, pediatric immunization coverage rates were fantastic, and it was a social note to immunize our kids. A lot of it was because of the Vaccines for Children program. I think we might be familiar with that program, and that really kind of equalized and made rates very good for pediatrics. Adolescents and adults, however, have always been kind of like the laggard stepchildren. We're always trying to get their rates back up, and then of course the pandemic hit, and so we were basically piling onto not the best coverage rates before the pandemic with a pandemic that shut us all down. And I think what we saw was after the COVID, the pandemic started, we saw, for example, this was a study that was published by Avalia Health, comparing pre and then during pandemic changes. And we saw things like a 86% decline in adolescent immunization coverage rates. And while the work of the providers have been phenomenal in bringing all of us back up to where we would like to be, we're still not there yet for adolescents. And in fact, there's some data out there from some of the our manufacturing partners, for example, that show that even right now, today, this current month, we are sitting at about close to a 10% decline compared to pre-COVID rates for adolescent coverage. And that is, and you were saying, well, okay, you went from 85 to 10%. That's a great improvement. Absolutely. But remember, we're piling on to coverage rates that were never that great anymore. And then in addition to that, if you look at catch-up immunizations, which is slightly different from the routine immunizations that I'm talking about, the catch-up means, adolescents that got one dose of a vaccine, but actually need 2 or more doses to actually be fully immunized, to be fully protected. Those catch-up rates are far below that 10% that I was talking about. So when we don't do that, per your suggestion, we leave our children vulnerable. We leave our adolescents vulnerable, especially as we're all longing. I have a kid in high school right now, longing to get these kids back into the social environment of high schools, right? So I think that's our big thing. We need to protect these kids as they start to re-socialize, re-engage in society.
Thank you so much, LJ. And I think since you were just talking about kind of, having a high schooler at home and helping ensure that kind of the catch-up immunizations is part of the really re-entry process for adolescents and their families. I just think it's then quite natural to turn to Principal Gordon and ask you, Principal Gordon, like, what role do you think school administrators and teachers can really play in helping to educate and support parents and young people in catching up on their vaccinations?
Well, first and foremost, good morning, Dr. Clinton, and to our esteemed panelists and everyone who's here watching this webinar. It is an honor to be here this afternoon. The role that schools and school administrators have to play is really just instilling confidence that the vaccines are something that is necessary, but also making sure that our families have all of the information. One of the things that our families really had a challenge understanding as we were dealing with the vaccinations and having those conversations, we were also expanding those conversations to all vaccinations. So we started to find out that the lockdowns and obviously the fear when all of this started included our families being very intimidated by the idea of actually going out and seeing a doctor for those vaccinations for all their children. People just did not want to take the chance of exposing themselves to COVID-19. And so we saw really an increase of the number of students who needed to get their vaccinations up to date across the board, not just COVID-19 being the topic of the subject we're talking about. So it's very important that we share the information with them. And also we're having now collaborations with our school district in trying to ascertain what the plan is going to be for school reopening. Right now we're doing a test run in Philadelphia where we're just opening up with a few grades to just see how we can make sure that our facilities are really up to date and make sure that we are really in a place to start receiving students. But again, in order to be able to fully open, we have to have the conversation around what the school district and the city is going to do around vaccinations, making them accessible to all families, and at the same time, continue to address the issues that are most concerning for our families in terms of, where those vaccines are going to be available for them if traveling is an issue for, a city like Philadelphia where there's a high poverty rate. So are the schools going to be involved in that conversation? So, I'm advocating for schools to be centers where the access will be available, because we're seeing that happening in the suburbs, and we're seeing an increase of vaccinations even amongst young people in our surrounding counties, because the schools are getting directly involved with allowing the schools to be access centers for a lot of our families. So we need to start having those conversations. And at the same time, one of the things that our families are really, really concerned about is really about our facilities, because in Philadelphia we have very old buildings, and so we are having conversations around what's the difference between airflow and air transitions, because that has to be addressed as well as part of the science that we're addressing. So again, we're just gathering all this information, and really we need to start making sure that that information is the correct information. It's out there, and we're combating, as it was said previously, all the bad advice that's being given on social media, which is really influencing a lot of the decisions by adolescents and their families, and the hesitancy about getting the vaccines. I just saw something on CNN just this morning about mommy groups that were combating bad information about the vaccines, and all the false medical information is being put out there, and the shaming that's been happening as a result. And so if that's happening with adults, I know that misinformation is really trickling down to our adolescents, and we really got to start a social media campaign by having the schools involved, because our great relationships with our students is going to really be key to getting our students vaccinated and getting them access to those vaccinations.
Oh, Principal Gordon, so much to think about, and clearly so much to do. And certainly, if there is anyone from kind of the local Philadelphia government or the Pennsylvania state government, I hope that they will follow up and reach out to you, because it is just so evident that not only, does the inequity between what you're seeing happening in the suburbs and not happening in Philadelphia itself need to be corrected urgently for your students and their families, in terms of being a vaccination site today for kind of older adolescents and their parents, but also to just kind of help build those relationships further, so that hopefully, when we do have approved vaccines, which is probably going to happen quite soon for 12 to 15-year-olds, and then according to Pfizer for younger kids, in September, if they stay on track, that it just will be kind of very natural for parents to support their then kind of younger teenagers, kind of preteens and younger kids getting vaccinated at schools. And just thinking of, you talk about being in Philadelphia, I of course couldn't help but think about Jonas Salk and the polio first kind of mass vaccination kind of polio efforts in schools, which happened, in Pittsburgh, not that far away. So kind of Pennsylvania has such an illustrative history of really kind of working with, through, and in schools to help vaccinate kids and adolescents. Dr. Coyne-Beasley, just, turning to you now, and kind of from kind of your perspective, really kind of with your doctor hat on, how are you talking to adolescents who may not think they need to come and see you, think like going to the pediatrician is like, that's just for younger kids, right? Like, I don't need to go anywhere. I'm like, I'm 14. Who needs to go to the doctor now? Like, how do you help adolescents really understand why it is important that they show up to their well child visits, even if, they don't want to think of themselves as a kid any longer, and get their routine immunizations? Oh, you're on mute. Dr. Coyne-Beasley. Oh, no, ma'am, you're still on mute.
All right. Well, thank you very much for that question. And I think it's really important. And that's why we actually try to set the context of them being well visits, as opposed to visits that are only when you are sick. But I do want to touch a little bit on something that you mentioned before, which was this area of equity. And when we think about vaccinations and who missed vaccinations during the pandemic, clearly we fell below, but the inequity between those who were publicly insured versus those who had private insurance was pretty significant. And I highlight that only because some of these vaccine-preventable diseases also disproportionately impact individuals who are from low wealth households or who are people of color. So for instance, cervical cancer. But we want people to come into well child visits because immunizations and catching up with immunizations are really important. Have the opportunity to help us fix that inequity that we saw with the vaccines that occurred during the pandemic. But we also want to talk to people about their social and emotional growth as well as their physical growth. So when we think about what was going on during the COVID pandemic, which still exists, of course, many of us remember there was also a pandemic within that pandemic. So we weren't just dealing with COVID-19 vaccines or COVID vaccine as a disease. We were also dealing with significant racial and social unrest and injustice in our country among multiple populations. So when Judy talked about stress, it's real. It's real as it relates to depression, depression, as it relates to anxiety, and as it relates to trauma. So one of the things that we do during well child visits, in addition to screening for cognitive and social and behavioral or even psychological and physical issues, is also examining, trauma. Is there and doing trauma-informed care, actually making sure that they're doing well academically, since we know that there were lots of transitions and difficulties and inequities in people's ability to access virtual platforms. So we look at well child visits as a chance to check in with our young people. And the thing that makes adolescent well visits important is that we have the opportunity to check in with families, with their parents, and then an opportunity to talk with them alone, where we sometimes are able to disclose or get information that we might not have been able to get otherwise. The main goal is to try to keep them well, which is why we call them well visits. But in addition to vaccinations, we have the opportunity to screen for depression and anxiety. We also have the opportunity to build their resiliency. Young people also have lots of great supports, and we can augment those supports and provide resources for them. So that's why we feel that it's incredibly important for them to come to their well child visits.
Oh gosh, there's so many questions I want to ask of you, Dr. Quinn Beasley, and everyone. I do, though, since we haven't heard from Kelly yet, I do want to give Kelly the chance, just really to reflect on what you've heard so far, Kelly. Like, do you talk to your friends about kind of when people are going to well child visits, or kind of however they might be called among teenagers these days? And, really just building on what Principal Gordon was sharing on all of the kind of misinformation that is flourishing on social media, and that, he is kind of receiving the consequences of when kind of his students and their families are asking him questions about things that they have, read or seen online. How much of that is a concern for you about vaccinations broadly? So let's kind of keep the conversation kind of broader, and then we'll go into the questions around the COVID-19 vaccine.
Yes, I think this is definitely a topic of conversation, particularly now. I think I've sort of worked in the adolescent vaccine space starting pre-pandemic. So I think it has been very interesting to see how this is sort of vaccines have entered this sort of natural discourse between teenagers. I do think it's also shown in sort of Unity studies that our adolescent perspectives on vaccinations have dramatically increased in sort of positivity during this time. I think there's definitely a sentiment of really knowing like why we want to be vaccinated, what vaccines are preventing, and a desire to protect those around us as well. I know sort of at the beginning of the pandemic, there was this idea that adolescents weren't really at risk of either getting COVID or the harmful sort of impacts of it. But we were told we should stay home to protect those around us who are adults or who are at risk. And everyone I know stayed home. And I think there's very much this sense of responsibility for our communities as well. I don't know that well child visits are a common topic of conversation. I do see people say now, I went to the pediatrician for the first time in a year, sort of that conversation. But I think vaccines are. I think we feel this sense of responsibility. I think there is it's overwhelmingly positive. I've also seen teens share a lot of pro-vaccine information from credible sources on social media. I think having sort of grown up around social media and in schools, we're taught how to navigate misinformation even. I think there's very much a opportunity in that, and having adolescents be this positive voice. But I would say what I've heard has been really overwhelmingly positive.
Well, that's terrific to hear. LJ, I do want to kind of look to you now as we kind of more narrow in on COVID-19 vaccines for adolescents and young adults. The New York Times had a story this morning on how many parents were still specifically hesitant around the COVID-19 vaccine. And many, Principal Gordon said they wouldn't vaccinate their children over the next few months, even those who likely will be eligible, 12 and up, unless their schools required it. And so, Dr. Tan, LJ, what is the current status of COVID-19 kind of vaccination rates among adolescents and young adults? And kind of really also building on, I think, Dr. Coyne-Beasley's really important kind of call out, kind of where are we on kind of the equity or inequity of kind of vaccination rates among adolescents and young adults who are eligible for the COVID-19 vaccines already. Oh, LJ, you're on mute.
There we go. That's a great panel of points there, Chelsea. I think I'm going to defer to Tamara with some of the equity issues because she deals with that so frequently, and I'll tee her up. But before we go there, I just want to mention this idea of the COVID-19 vaccines that you already kind of hinted at this, that we will probably have a recommendation from the ACIP next Wednesday on how to use the first set of COVID-19 vaccines that are going to be coming out, the Pfizer vaccines, for adolescents 12 to 15 years of age. And so I think it's exciting. I think one of the things we have to remind ourselves, and I'm a parent of a high school child. My high school child actually is a boy who's 16, but he's actually at high risk, and he's already been vaccinated because he has a high risk condition that made him eligible. And I did not hesitate. So I think folks like us role modeling this confidence in the vaccine is extremely important. And so I'm hoping that, using these personal stories about our own adolescents getting vaccinated would be one way to help assure some of the parents of our confidence in the vaccine. But that the fact that we do that is because of the transparency in the science and the safety profiles of these vaccines. I mean, the fact is these vaccines have been now given to hundreds of millions of people across the world. And we have a system of surveillance in the United States and in other countries that have detected, if necessary, any kind of potential adverse events. And these vaccines are incredibly safe. And I think what we need to do is emphasize to parents who are kind of sitting on that fence, wondering whether or not they should, is firstly, that these vaccines have undergone phase 3 clinical trials for 12 to 15 for the Pfizer and then 12 to 17 for the Moderna vaccines. That data is about to be looked at and then by the ACIP for a recommendation. There is transparency in that entire process, more than I've seen in any process in the healthcare field. I think it's amazing how the COVID-19 vaccine process has been so transparent with data and with forthcomingness about protocols of how to generate that data. And then finally, I think for us to essentially emphasize, I have a 16-year-old boy, he's fully vaccinated, and guess what? He hasn't grown any horns. And I think the equity is important. I think, so my high school here, I'm a suburb of Chicago, and granted it's a progressive suburb, but they're making vaccines available through their high school system because of exactly that idea, right? Throughout COVID, this high school has been delivering meals, per before COVID, and so at the same time they're trying to improve that access to adolescents who may have access issues. Sometimes I think we want to make sure we don't think that just that a hesitancy that the coverage rates in racial minorities that look lower, we want to make sure that that's not because of what we perceive to be some kind of cultural bias. It may simply be access. They simply just can't get to the vaccine, and it's not about cultural bias or hesitancy. So let's not assume that without checking access issues. So thank you. I mean, that's so much to talk about. So thank you. Tamara, I want to just sorry, Chelsea, go ahead.
No, LJ, I was just going to say, yes. I mean, certainly, we've seen in state after state, oftentimes, Latinx communities, have the highest enthusiasm for kind of vaccinating themselves, their family members, and yet often the hardest time accessing the vaccines. And so I do think it's really important that we continue to focus on the real access challenges. And I certainly was encouraged to hear earlier this week, even that the Biden administration, recognizing how many access challenges there are, especially in rural parts of our country, is going to be working more intensely with federally qualified health centers and other kind of trusted places where kind of people hopefully now will have, a much shorter, easier, accessible way to get vaccinated. But please, Dr. Coyne-Beasley, what can you share about kind of what you're seeing in your own experiences and kind of what is happening for adolescents and young adults with accessing the vaccines? Kind of how are we doing on helping young people who are now qualified getting vaccinated, and how are we doing on equity when we just focus on the adolescent and kind of young adult population?
Yeah, lots of really great questions in there. I'm going to try to unpack some of those, certainly, and some we'll get to, I assume, later on today as well. But I think it's important for us to know first, to understand kind of what the actual situation is, because I think that we underrepresent the fact that it actually can impact adolescents and impact them pretty significantly. On Monday, the AAP actually reported that about 1/5 of all cases now are in adolescents, 22.4% to be exact. And so getting vaccinated for this population is incredibly important, because the more they delay and wait for a vaccine, of course, we've got to wait for them to be authorized, the more likely they are to actually get the vaccine. To get the disease, COVID. And I think when we talk about equity, one of the things that's really important is when we look at all COVID cases against children and adolescents, they are disproportionately impacting Latinx populations, African Americans, and as well as Native Americans. So there's a real important impetus for actually getting them vaccinated, because it doesn't just impact them, it impacts their families. And we saw the exact same pattern of COVID disease among adults, affecting those populations more gravely. I'm so happy that LJ talked about the access issues, because there are so many access issues that come along with getting COVID. Not only were there disproportionate people who lost their jobs, which are then tied to their insurance, they may have transportation issues. So it made it very difficult for families of color. I think the other thing that is important that many people don't recognize is that people of color are also disproportionately impacted by multi-system inflammatory syndrome in children. And as of April, we have now over 3,000 cases of that. Again, disproportionately impacting populations of color. And so what I want us to really think about, and physicians and all of us in schools, there's so many things we haven't even thought about now, need to really be considered when we think about vaccine rollout for children, because we don't want to see, again, the most vulnerable or those with access issues being left out. The other thing I would like for people to really understand is, yes, we do know that COVID disease seems to be less impactful in children, again, depending on your perspective, but if we're just counting numbers. However, it's not without consequences in children. We're grateful that it's generally rarely a fatal event in children, but we have now over 300 children who have died from COVID disease. And so, in fact, it is something that can happen. It can also have hospitalizations, which can be significant. We're also starting to notice that there are some cases where there is this long-term COVID that we're still learning more about. Doesn't seem to be as great in numbers as we see for adults. But again, remember, we're continually learning about COVID. And we've already talked about multi-system inflammatory syndrome in children, again, disproportionately impacting people of color. But again, another really significant outcome for kids that we don't really know the full extent of, where there already are issues of equity. So why do I feel like vaccinations are so important? They're just as important as they've been in everything that we've seen throughout history. Not only have they had the opportunity to eradicate diseases, but they can significantly reduce health disparities. And we have seen vaccines do that through our life course and through our experience with vaccines. And so I believe that a COVID-19 vaccine fully utilized and implemented can actually not only decrease COVID disease in our population, but also eradicate or certainly reduce some of the health disparities we're seeing in these very important outcomes.
You know, thank you so much, Dr. Coyne-Beasley. I couldn't agree with you more emphatically, and certainly hope that we can learn from what didn't work, especially from a health equity standpoint in the initial kind of rollout of the COVID-19 kind of vaccines to adults, to ensure that we are very much centering health equity and vulnerability as we roll out, hopefully quite soon, as LJ was indicating, vaccines to kind of 12 to 15-year-olds, and then certainly, you know, within just a few months, you know, vaccines to younger kids. And I will say, LJ, I really wanted to sign my kids up for the Pfizer trial in New York. The closest site that was in Rochester, which for those were not in New York is about a 5.5-hour drive from New York City. And I just couldn't quite, I thought my children are forever then going to associate like very long and arduous car rides, with vaccinations. And so I didn't think that was really a helpful correlation in their heads. But certainly, when we do kind of get our routine flu vaccinations every year, or after we take our kids to well child visits, it is something that I talk about doing, because I do think that those of us who have platforms need to talk about vaccines, vaccinations, the positive effects and importance of vaccines for our kids' health as well as for our community health, because we know that the anti-vaccine community, unfortunately, is constantly proliferating, misinformation, disinformation. And so, Principal Gordon, I want to turn to you and then really turn to Kelly again as well, now that we're kind of in this conversation about COVID-19 vaccine specifically. Principal Gordon, what are you hearing from your students or from your parent community as to what are their concerns, kind of what are their various levels of enthusiasm or the opposite, and how are you engaging in conversations to hopefully kind of root the decisions they're thinking about making in the science?
Well, I can assure you that my students tell me every day that whatever they have to do in order to get back to in-person learning, they are willing to do. So even if they have to inject the vaccine themselves, they are highly enthusiastic about getting back to school. They are over this virtual learning world because they've been terribly impacted on a number of issues, not just academically, but also socially and emotionally. And it's really been tough. And so we've been trying to do our best to support them through this. But our panelists have really touched on something. Again, they're spot on. And I'm so just happy that they're bringing this up about the point of access, and that's why I mentioned about schools being sites, because a lot of our parents are sharing with us that they're behind with getting their own vaccines with COVID-19. They're also behind in their children's vaccines across the board because they just can't afford to miss work, or they just can't afford to, get the vaccine and then have a react. They're worried about a reaction and they're down for work for a day, and they're going to have to, take a day off from work when we know that the economy has really been problematic for a lot of our families who are trying to really make ends meet at this point. Again, in Philadelphia, which are a high poverty city. So it's really a point to really recognize what our parents are going through. There's a high enthusiasm when it comes to our students. And when we're talking about students getting the vaccines, and we know that students who are 14 years of age and older are making medical decisions also as well, that has to be a factor we take into account when we're talking about doing the vaccines at school, and really utilizing the schools and our staff members who have great relationships with our students as an advantage to talk about the great things about like what the vaccine is going to allow us to do, to allow us to rebuild our community, come back together again, and really get rid of that disinformation and close out the noise that they're getting from social media, because families who are having these conflicted conversations are hesitating to come in because we're hearing things like, "Oh, they're experimenting on us," or "Can we trust this?" So that's why we have the Black Doctors Consortium here in Philadelphia giving the vaccines, and again encouraging and in the communities every single day, building confidence amongst the populace, because we need that conversation to continue to happen in all aspects of our community. And so, again, we're seeing a high enthusiasm amongst our students. We're seeing some hesitancy from our families because they are dealing with so many other priorities that is preventing them from conveniently actually accessing the vaccines. And so we can actually do more around the point of our access. We will see an increase. I believe we'll see an increase of vaccinations taking place amongst our adolescents because they really do trust what's happening in most of our schools. And I would tell them all the time that I'm vaccinated, and you know that I've never told you anything that's against your benefit. And I'm pretty sure that if you do this, we'll be able to get back to in-person learning and get back on track and continue to build a strong community.
It's just so encouraging, Principal Gordon, to hear all of that. And I also was so encouraged, Kelly, turning to you again now, to hear you talk about how much like pro-vaccine and pro-public health content that you thankfully see your peers generating on social media. And since you kind of were a vaccine activist before COVID, so have kind of more experience than just the last 15 months, could you share with us what have you found to really work to help educate your peers online on social media or in real life around vaccines and vaccinations? Because I think not everyone may be as lucky to have a principal like Principal Gordon. So for others who are here listening, wondering how do I talk with adolescents, with teenagers about why it's so important that they get vaccinated, and hopefully that they want to get vaccinated. Just what advice would you have from your experience as a vaccine advocate online and off?
Definitely. I think it's very interesting. I entered the sort of vaccine space, actually seeing posts on social media from teenagers who wanted to be vaccinated, and their sort of this desire to be vaccinated diverged from the opinion of their own families. And so they had families that were sort of ardently against vaccines, and they really wanted to protect both themselves and their communities. And so they turned to social media to find out sort of what role they could play in making this decision for themselves, as sort of was referenced earlier in this idea of the role of adolescents in medical decision making. So that's actually how I entered the space. It was very much seeing this desire to be vaccinated among my peers and a desire to sort of help them do so and empower them. And so I think, yes, I think definitely the sort of tenor and tone of conversations among my peers has become overwhelmingly positive. I think vaccines really, there is this idea of schools, et cetera. There are also colleges that have already sort of put requirements in place. And so there's very much this idea of, if I'm vaccinated, this is a sense of freedom and hope and getting my life back. And it means so much to everyone around me. I think, so while the tone is really overwhelmingly positive, and I think if there is a sliver of sort of benefits, a good thing that comes out of the pandemic, I think, is this view of adolescents, from just those who are sort of in the situation, who already had to think about vaccines, to all adolescents thinking about vaccines in a positive light. I think there is the one issue I do see is it's not really as much hesitancy to get vaccinated as a whole. I think there's a desire to do so. I think there is sort of sometimes some hesitancy or confusion around the actually what vaccines and what do they mean. I think we all hear lots of tidbits of sort of scientific or non-scientific information that is presented as science sort of being bandied about. And I think there's sometimes questions about the context or impact. So obviously, while adolescents can't get the J&J vaccine, I think there's, this percentage of efficacy of the vaccine seems lower, but needing the context that it was tested at a later date against more infectious variants, which is why even though a sort of number may be lower, it actually was a harder trial. And so the efficacy is sort of on par with other vaccines. And so I think there is definitely, having worked in the space and having seen this desire before and after, I think there's definitely a need to empower adolescents. There's a need for education as well. And in my own work, we're now working on a curriculum for schools. I think there's also a huge opportunity in peer-to-peer interactions, and providing sort of non-judgmental spaces to ask questions, have these conversations, discuss. And I think that's happening. And I think really adolescents have such an important role in advocating for themselves, advocating for others. And in these situations where you do have a parent who's hesitant, their kid knows them best. They're in the best situation to navigate that hesitancy, to address their concerns. They're in school. There is a perfect opportunity to educate them. They're being taught how to navigate misinformation. Even in Philadelphia, actually, it's different from the state of Pennsylvania, where minors are actually able in Pennsylvania to consent to some vaccinations. I think there's a huge role they have, though, in just in their own families and getting vaccinated and advocating. And so I think there is a need for peer-to-peer education, for providing spaces in classes. I think teachers are an incredible source of education. My own biology teacher, I was in biology class when sort of the pandemic hit. She transitioned our class. We did a giant unit on vaccines. She let us ask any questions we had. So I think there's so many opportunities, and I think adolescents have a hugely powerful role in their own families and their communities in sort of advocating to get vaccinated.
Yes, like just such an emphatic yes, Kelly. I do want to leave time for audience questions. So I hope that you, if you do have questions for any of our amazing panelists, we'll use the Q&A function. And hopefully while you're thinking of questions and submitting questions, I do really want to turn to Dr. Coyne-Beasley again and LJ to just ask for both of your kind of thoughts on how do you think we best ensure that kind of every 12 to 18-year-old is able to be vaccinated. So how do you think about kind of ensuring that it's easy for kids, for families to ensure that their kids are vaccinated? So kind of how do we think about that in the context of already planned well child visits? How do you think about that in terms of parent communications? What other partners would you really think would be very helpful along with schools for all the really compelling reasons that we've heard from Principal Gordon and from Kelly? So, if the White House were to call and say, Dr. Coyne-Beasley, like how should we think about ensuring that we're going to equitably and effectively, efficiently vaccinate preteens and teenagers in our country? What would you say? Oh, you're on mute. Oh. You're still on mute, ma'am. Oh.
And it's really a great question because I think there are lots of different strategies. So there's not going to be just one. And I'll tell you, I've done a lot of work internationally. And one of the ways that they actually have done vaccine campaigns in the past and have been very, very successful is by going door to door to door. Now, somehow we haven't really done that in large scales, in recent years in the United States. But going to where people at is really the main tenet of trying to make sure that everybody gets vaccinated. So we've got to figure out, does that mean going to everybody's neighborhood, of course, with some introductions and some engagement of community members before doing that. But let's take that basic principle about going where people are. Schools are one of the most common places where young people are. And so schools offer an amazing opportunity to provide vaccinations. But what I would also say is that remember, we're trying to take care of our young people holistically. And so when I think about schools and as an adolescent medicine provider, I'm going to talk about school-based health centers. So we're not just going to vaccinate. We want to be able to actually help take care of their psychosocial health, their well-being holistically, because you have to remember over 500,000 people died. And so there are young people who have lost family members, who are trying to reintegrate into education. And so while we think about vaccinations, let's also think about the consequences of this disease and how it's impacted our young people. In addition to schools and school-based health centers, I'd look into after-school programs. I'd look into youth programs that are held by many community organizations. I'd even look at juvenile justice detention centers, where not only is it a real important nidus where you actually can have the spread of the disease. I'd look at programs like the YMCA and youth sports programs. These are important places where young people spend a significant amount of time. But again, I am not above, and I think we really need to think about for those people who may not be able to even access those programs, because there is some advantage in getting into those programs, going to their neighborhoods. From a perspective of, say, healthcare providers, which sometimes do have an opportunity to engage with people with low resources, we need to think about how can we get transportation if that's the way we want to do it? How do we expand community health fairs? How do we actually call families up, taking an inventory of our patient list and see who's up to date or not up to date, and who can we call in for their vaccines? And of course, who can we talk to about COVID? In our office, we've already started talking about COVID vaccine and its use in adolescents and young adults, as well as children, so that our parents are already primed and already able to ask us questions. So hopefully when the vaccine rolls out, we'll actually be able to get it for them. And then there are evidence-based strategies. We already talked about recall and reminder strategies. Those of us who have people in our practices, we can schedule preventive visits, and we can also, again, just really engage in the community with community partners.
And LJ, what else would you kind of add if the White House were to call you? Kind of what else would you add to kind of what Dr. Coyne Beasley, I think, laid out so well?
I think the very biggest point is exactly the one she made, which is we've got to look at bringing the vaccines to where the adolescents are. I think firstly, we want to think about this idea that what are we going to be doing this summer, right? Because this is urgent. This is coming up. We're going to have adolescent vaccines, not just for COVID-19, which has been a lot of what we talked about, but we got to figure out how to catch these adolescents up, along with the concerns that I mentioned earlier. So I would say, folks, take a look at this campaign, right? Don't wait, vaccinate by Unity. I think there's a lot of great information there for healthcare providers, for parents, and for teens to at least start the ball rolling. And a lot of this campaign focuses on this idea that the adolescent is the center, and we build an immunization neighborhood around that adolescent. Right. So we need to have everyone united around a common message, right? The healthcare provider, the pharmacist, the school, the teachers, and the health clubs, the areas where teenagers are going to start beginning to socialize this summer, because we are beginning to try to open up. We need to get there, build that neighborhood around them, and have them hear this message that it's not just COVID-19 vaccines. We want you to get that, but you're not done yet. We still have routine immunizations. We still have catch-up immunizations. And then that's the summer. Then we go into the fall, and here's where Richard, right? I mean, schools hopefully are going to open up. Pray. Let's get them open, right? We need to get them the social environment again. And then the school-located immunizations have been very successful for flu programs in the past. And we should be thinking about some of those alternative ways to get vaccines again to where the adolescents are. So just a couple of points to follow up on. Great points by Tamara.
Yeah, please, Principal Gordon, I was going to turn to you next. So perfect.
No, again, that's why I'm enjoying being on the panelists, because they're spot on. LJ, I really put the point that I wanted to make, which was, this summer, part of the rescue plan funding is talking about remediation and some of the summer enrichment programming that we're going to put in place. And so, when the White House calls me, because they call me all the time, you know how that is. Anyway, so that we should be having that discussion about how we can utilize schools and school activities throughout the course of the summer, as part of our reopening plan. I've just been asked by my superintendent to be part of the reopening plan for Philadelphia for fall reopening. And that's one of the conversations that I really did want to have, to figure out how, again, we talk about health centers. How can we centralize? We're talking about remediation opening for, centers around the city for students for summer enrichment. We got to do the same thing for the vaccinations as well. If we're really going to be truly prepared for fall reopening, we've got to have this conversation around COVID-19, but also all vaccinations as well. Because again, regardless if it's COVID-19 or if it's meningitis, which is affecting a lot of my seniors who haven't gotten it, and I'm trying to push to get them to get that before graduation comes, because graduation is in person. We have to have a conversation about making sure that all vaccinations are available for all families and make it very convenient. And as Kelly mentioned, because we have consent that's being allowed with our teenagers, then let's utilize that advantage with everything, the singular messaging, the support from the federal government with the rescue plan and the reopening of buildings, so that we can have enrichment programs along with health centers, and actually have an actual coordinated effort, so that fall reopening is the goal, so that we come back fully with all students, rather than looking at how we're going to have a hybrid program once again, which is again going to prolong the effect of the pandemic that students have been struggling with for the last year and a half.
And Dr. Coyne Beasley, could I ask you, for just anyone who's joining us who may not understand kind of why it is important that kind of vaccinations be coordinated. So, Principal Gordon spoke about the meningitis vaccine, and it's just like breaking my heart to hear that so many of your seniors haven't gotten that shot yet. But I know with your support they will. But just how do you, Dr. Coyne Beasley, talk to the parents in your practice so that they understand kind of how, yes, there has to be kind of the surrounded kind of vaccination that LJ spoke about, but actually these have to be sequenced. There has to be a choreography to them, especially given the recommendations around kind of not having other vaccines kind of when you are receiving your COVID-19 vaccine. So could you just kind of, better than I certainly did, explain that for anyone who's listening to us and talk about how you're having those conversations with the adolescents and parents in your practice?
Sure. So I'm going to say one thing about the COVID vaccine and how it can and cannot be administered around other vaccines. The ACIP and the CDC and other organizations will be rediscussing that. And so I don't think it's that definitive yet. However, for the vaccines that have been recommended for use in adolescents and children, there are distinct time periods by which they need to get them. So generally, if you are longer than the specified recommendation of interval, you're okay and don't have to restart it. But you don't want it to be too close or less than the recommended time, because you won't have the opportunity to boost immunity. So it is important to get vaccines as close to as they're scheduled as possible. And again, we'll find out kind of next week what we might be thinking about with the COVID vaccine in terms of its interval scheduling and scheduling with other vaccines. And so one of the things that again, if the White House were to call me, that I think, we could learn from other countries is that people carry around a vaccine passport. And like any of us who got our COVID-19 vaccine, we actually got a card with that on that we carry around from us. I remember when I lived in Tanzania, I actually had a yellow vaccine card that said that I got the yellow fever vaccine that I carried with me every time I traveled. And so one thing that would be really helpful, I think, one is registries. It would be really nice if there was a vaccine registry in every state, and even better, perhaps even nationally. So if you move and travel, you'll be able to have that. But for adolescents and families to really keep track of the vaccines that their young people have had, because it can be confusing. And if you were able to show a physician a list, we could tell what they need and what someone doesn't need. So for instance, there are two different vaccines against meningitis. And so, well, it depends, actually. If we're talking about H flu, it's another one. So you need to know what someone has gotten in order to know what they're due for. And I want to stress something I think LJ and Principal Richard said that's really important, is that we need to start doing this now. Everybody thinks about vaccinations when we get ready to go up to school. But as healthcare providers, when we see our patients, we shouldn't let a missed opportunity or a missed visit go without looking at their vaccine records. When I was talking about recall and reminder schedules, I'm asking for that to start now. So as providers, if our office has a capability to run the immunization lists on our patients, start calling those individuals now to get vaccinated now for anything that they're due for. And then if there happen to be overlap issues, say with a COVID vaccine, you will have already gotten those vaccines that you need for catch-up. So it can be difficult to coordinate sometimes, but your healthcare providers can help you with that. And so the knowledge that we need can come through vaccine registries. But my kids who are young adults, they actually have a list of all the vaccines that they have taken, that they actually, if anyone were to ask them, that they could pull out and show to someone. And we should have some system like that where people are able to recall what vaccines they got. Because it's hard to ask a young person what vaccines you've gotten for them to be able to tell you.
Yep. Principal Gordon, were you?
Just real quick, again, we have to do this now. The messaging is already out there. Everyone's giving dates for full reopening. We're talking about Memorial Day, 4th of July, so all the states are coordinating. And right now you got states who are competing against each other for business purposes. But now I got to start thinking about school reopening and how this affects adolescents as well. So now is the time. I understand that we want to think about the economy, and that's great, but we also got to make sure that people don't get lost in our fixation on trying to get the economy up and running. And if this is a challenge, but it's also a great opportunity, and it should not be lost because we're thinking about the economy only.
Well, Principal Gordon, child immunizations and getting kids back to school is also fundamentally about the economy. And we know that 2.5 million women have left the workforce over the course of COVID-19. And I'm incredibly grateful that Vice President Harris has said it will be one of her kind of real areas of focus over the next year to understand how to support women many, overwhelmingly, who were mothers and could not balance full-time childcare with full-time work, or were in jobs where working from home was not an option. And we know that that economic impact on women and their families, also, as all of the impacts of COVID have, fell most heavily on low-income women and women of color. And so, these are economic issues. I mean, they are public health issues, they are equity issues, and they are also economic issues. I know we only have a few minutes left of the webinar, but I just think it would be odd to not give the last word before Judy closes out to Kelly, our resident kind of adolescent and young person. Just, Kelly, is there anything that we haven't talked about that you wish that we had kind of from a young person's perspective, or are there kind of messages that you want us to kind of leave here knowing are especially effective in talking to young people about the importance and the science of vaccines and vaccinations?
Thank you. I think something that I've also seen sort of being asked in the chat as well, and that I think is a lesson for so many people who are attending this webinar who are sort of in the public health space, is the value of sort of providing an opportunity for asking questions without judgment. I think the Unity has some great messaging around this with the meningitis B vaccine, which is defined sort of by the ACIP as a sort of shared clinical decision making. So it is not usually really mandated for schools, but it is a sort of choice that should be made. A provider should have this discussion with a parent and an adolescent. And I think something I love is they ask in these sort of recommendation videos, they always ask, what do you know about the vaccine? And then what questions do you have? And just providing that opportunity in a way that is inclusive and non-judgmental, I think there's such value to that. I think there is this overwhelmingly positive sentiment, but there are these sort of tidbits of misinformation being shared, or there are these questions. And I think anytime you can ask and you can be a resource of sort of factual, science-based information is amazing. And I think for everyone watching the panel, and how you can empower an adolescent by doing so is really a message to take away. So whether you're providing the space or you're sharing resources in your class, I think is just the best way we could really possibly go about this. And really there is such power in adolescents and doing this, not just when a minor is consenting themselves or in a sort of time when maybe a parent is working and they can't go with their kid to a vaccine. That is really actually a huge cause of sort of missed opportunities of vaccination normally, but also in the sense of what role can they play in their own families? We see in terms of racial inequities, we see often sort of minority groups have the highest initial uptake of the HPV vaccine. They have the lowest completion rate because it's so difficult to sort of complete the series and get in, and there's these access issues. And so can an adolescent remind their parent and say, hey, I know that I need that second HPV vaccine. And can they say, hey, I can also get it at school. What can we do to support them in these ways? I think is so important to recognize. I think Unity is really doing a great job, and I definitely recommend sort of watching their recommendation videos.
Well, thank you, Kelly. And I know we're out of time. We got two questions like just now at the last moment. One was about kind of state vaccination registries, and the other was about kind of what role pharmacies can play. And I think those are really good questions. And I hope that you will reach out to Judy and Unity, because I'm sure they'll have really robust answers. And I do want to hand it back to Judy to close this out today. But I just want to say on a personal level, kind of on an advocacy level, how just fantastic this conversation's been, and how honored I've been to be a part of it with LJ, with Professor Gordon. Like, you make me think about Principal Gordon, like my Principal Hart, who was my elementary school principal, and just, you remind me so much of her, and she was amazing. And I hope that my kids are lucky enough to have principals like Principal Hart and like you and Dr. Coyne Beasley. Thank you just so much. And Kelly, thank you for all that you're doing kind of with your peers and for your peers. And so now with pleasure handing the conversation back to Judy.
Yeah, I'll just be real quick, but thank you so much. I am so grateful to all of you for your really amazing passion, your insights, and your suggestions. I just want to end with, what can you all do as participants and listeners? Spread the word on social media. You heard from everybody how important that was. Check out Unity's Don't Wait, Vaccinate page, which is a website page. And just on behalf of Unity, our board, and all of our members, thank you so much to Dr. Chelsea Clinton and all of our panelists, and hope you all have a safe and wonderful day.
Thank you.
Thank you. Thank you, Dr. Clinton. That was awesome.